All right, let's take a look at another one of these questions. We talk in our books and in our lectures, in our lecture series, about a referral brochure. It's a device that helps you increase the number of referrals, okay? And we've developed over the years a piece for that. So the question is, how is that piece or whatever somebody's using, how is that deployed in a dental office?
So in other words, the system, how do you use it?
Right.
All right. Well, first of all, referrals are in the internal promotion category. It's one of the things that you always invest money in every year with your marketing budget. So you talk to your advisor, they allocate a certain amount of money to your internal every year. The referral brochure is part of that. The idea behind the referral brochure is to create a system by which your staff comfortably asks the patient to refer their friends and family without the doctor having to do that, but also giving the patient something tangible to take home to take action with.
Right.
Okay? That's the referral brochure part. All right? Now you see all this chatter and all this discussion on dental forums out there. I'm going to offer $50 for a referral. I'm going to tell all my patients. Well, okay, the state board in 32 states is going to send you a letter and you're going to have a nasty gram, okay, because you're not allowed to do that. You're not allowed to solicit referrals. You're not allowed to reward for referrals prior to them happening. Right. You are allowed to send a person who's already referred a thank you gift.
Absolutely.
But you're not allowed to tell the patient, I'm going to give you $50 if you refer. You're not allowed to do that in 32 states. So how do you solve all those problems and make it easy for everybody, including the doctor and including the staff? And the answer is the referral brochure. And the way it works is your hygienist presents these at the end of the hygiene visit that does not require additional operative treatment. In other words, the only thing the patient needs, they have a clean bill of oral health. They just need a recall for 6 months from now.
Yeah.
That's all they need.
Yeah, the operative stuff is done.
The hygienist at that point grabs a referral brochure and says, Mary, how did everything go today? Mary's happy. Oh, it's great, thanks. Okay, well, everything looks good. Your doctor came in and did the exam. Everything looks good. We'll just need to see you back for your professional cleaning in 6 months, okay? And how do you like it here in general, in a dental practice, Mary? And Mary says, I love it here. Says, okay, here, I'm going to give you 3 or 4 of these. You put these in your purse, take them home, maybe put them up in your refrigerator or in your takeout menu drawer. This is a gift for anyone that you might know that's looking for a great dental practice, because we love working with you and we'd love to have your friends and family come visit us and become part of our dental practice. And that's it. You don't open it, you don't read it, you don't, that's it. It's just a real short conversation, okay? Now, the assistant does this at the end of the last operative treatment visit, shortly before scheduling for them for the next recare. In other words, their operative treatment is complete, okay? There are 2 times in your dental life that your patients are the happiest with you. The first time is when their treatment is done, and the second time is when they get their teeth cleaned and they don't need any more treatment, okay? So you present these at those intervals, and you'll notice that I never said the doctor has anything to do with this,
right?
Okay? The doctor shouldn't be asking. Right. That's the part of this interaction or the social interaction between the doctor and the patient that doesn't feel right. It doesn't feel right to dentists to ask a patient to refer their family and friends.
Right.
So some of you are really, if it doesn't feel right, you don't do it. And even if it does feel right, it still doesn't feel right. Right. But some of you still try to do it. Right. You don't have to do it. This systemizes everything out. And what you'll end up with is maybe 1, 2, maybe 3 additional patient referrals a month. But the cost is almost nothing.
Right.
And the revenue that's brought in by those 2 or 3 additional new patients each month is very high. So the ROI is astronomical. Right. Right, because they're low cost.
And the back end of this is, what do you do after they've referred somebody? How do you thank them?
Right.
Okay. And this is the last part of the equation. And you can thank them with any number of things. You can use gifts, send a bouquet of flowers, a coffee cup to their work so that other people notice it.
Gift cards.
All of these things,
right.
Movie tickets, those are acceptable as thank yous, but never prior to the referral, because then you're soliciting. You see the difference? I hope so.